The year was 1960, a time of great scientific exploration and innovation. Dr. Paul Janssen, a Belgian chemist, was on a quest. His goal was not just any ordinary mission. His mission was to develop a powerful new painkiller, one that could revolutionize the field of medicine. After countless hours of research and experimentation, he succeeded, creating a drug far stronger than morphine. This new drug was fentanyl, a synthetic opioid that would change the landscape of pain management. It was a breakthrough in pain management, offering a new hope for those in severe pain. Fentanyl was hailed as a miracle drug, a beacon of hope for patients and doctors alike. It offered relief for patients suffering from severe pain, providing a level of comfort that was previously unattainable. Its use became widespread in hospitals, particularly during surgeries. Doctors lauded its effectiveness, and it quickly became a staple in medical practice. Cancer patients found solace in its ability to ease their agony, allowing them to live with a semblance of normalcy. For a time, fentanyl seemed like a triumph of modern medicine, a testament to human ingenuity and the relentless pursuit of better healthcare solutions. But like a dark cloud on the horizon, the potential for misuse lurked. The very strength that made fentanyl so effective also made it dangerous. This potent painkiller, a beacon of hope, would soon become a harbinger of despair. Its misuse and abuse would lead to a crisis of unprecedented proportions. The story of fentanyl is a cautionary tale, a reminder that even the most promising discoveries can have unintended consequences. It serves as a stark warning of the fine line between medical marvel and potential peril. The 1990s saw a dramatic rise in the prescription of opioid painkillers, including fentanyl. This period marked a significant shift in the medical community's approach to pain management. Pharmaceutical companies, touting their benefits, aggressively marketed these drugs to doctors. They launched extensive campaigns, using persuasive tactics to convince healthcare providers of the efficacy and necessity of opioids. They downplayed the risks of addiction, assuring physicians and patients of their safety. These reassurances were often based on misleading or incomplete data, creating a false sense of security. Patients, desperate for relief from chronic pain, readily embraced these new medications. Many saw opioids as a miracle solution, offering a way to reclaim their lives from the grip of relentless pain. What began as a genuine effort to alleviate suffering soon spiraled into a public health crisis. The widespread availability and liberal prescribing of opioids led to unforeseen consequences. The overprescription of opioids created a generation reliant on these powerful drugs. The consequences were devastating. Communities across the nation began to see a rise in addiction rates, overdoses, and related deaths. People, initially prescribed opioids for legitimate pain, found themselves trapped in a cycle of addiction. The physical and psychological grip of these drugs was profound and often inescapable. They became dependent, needing higher doses to achieve the same effect. Tolerance built quickly, leading to escalating use and, in many cases, dangerous levels of consumption. The line between medical use and misuse blurred, setting the stage for the emergence of a deadly black market. As prescriptions became harder to obtain, many turned to illicit sources, further fueling the crisis. As prescription opioid addiction surged, so did demand. This created a lucrative opportunity for criminal organizations. Seeing a gap in the market, they recognized the profit potential of fentanyl. Illegal fentanyl, manufactured in clandestine labs, began flooding the streets. This wasn't the carefully controlled fentanyl used in hospitals. It was often laced into other drugs, making it cheaper and easier to produce. This potent and deadly substance quickly infiltrated the black market, spreading like a virus across America. The dangers were compounded by the fact that many users were unaware they were even consuming fentanyl. It was a hidden killer, masked as other substances, catching countless unsuspecting victims in its deadly web. Fentanyl's potency is staggering. It is up to 100 times stronger than morphine and 50 times stronger than heroin. Even a minuscule amount, equivalent to a few grains of salt, can be lethal. Drug dealers often mix fentanyl with other drugs like heroin, cocaine, and methamphetamine. This is done to increase potency and maximize profits. The result is a dangerous game of Russian roulette for users who may be unaware of the deadly adulteration. This potent cocktail has fueled a surge in overdose deaths across America. Many victims are unaware they are consuming fentanyl at all. They believe they are taking their usual dose of heroin or cocaine, only to be met with a fatal dose of this invisible killer. Section 5. Overdose epidemic, a nation in crisis. The United States is in the throes of a devastating overdose epidemic. Fentanyl, with its incredible potency and widespread availability, is the driving force behind this crisis. Statistics paint a grim picture. In 2021 alone, over 100,000 Americans lost their lives to drug overdoses. Fentanyl was involved in a staggering 2/3 of these deaths. This crisis has touched every corner of the nation, from bustling cities to rural communities. The impact on families and communities is immeasurable. The loss of life, the shattered dreams, and the economic burden have left an indelible scar on the nation's psyche. Section 6. Shattered lives, the human cost of fentanyl. Behind the statistics are real people with families and loved ones. Fentanyl doesn't discriminate. It has claimed the lives of teenagers experimenting with drugs for the first time. It has taken parents from their children, leaving behind a void that can never be filled. The ripple effects of this crisis extend far beyond individual loss. Communities are grappling with an increase in crime, a strained healthcare system, and a generation of children growing up in the shadow of addiction. The human cost of fentanyl is immeasurable, leaving behind a trail of devastation that stretches across the nation. Section 7. Fighting back efforts to combat the crisis. Despite the scale of the challenge, there is hope. Across America, medical professionals, law enforcement agencies, and community organizations are working tirelessly to combat the fentanyl crisis. Naloxone, a medication that can reverse opioid overdoses, is being widely distributed to first responders and community groups. Efforts to educate the public, particularly young people, about the dangers of fentanyl are gaining momentum. Law enforcement agencies are cracking down on drug trafficking networks, targeting the source of the illegal fentanyl supply. Treatment centers are working to provide support and recovery options for those struggling with addiction. Section 8. A call to action, hope for the future. The fentanyl crisis is a complex issue with no easy solutions. It has infiltrated communities across the nation, affecting people from all walks of life. The devastating impact of this crisis can be seen in the rising number of overdoses and the heartbreak of families torn apart. But we cannot afford to be complacent. We must recognize the urgency of this situation and take decisive action. Every moment we delay, more lives are at risk. This is a call to action for everyone to come together and address this national emergency. It requires a united effort from individuals, communities, and policymakers. We need greater investment in prevention, treatment, and recovery programs. This means funding for mental health services, addiction counseling, and rehabilitation centers. It also means supporting research into new treatments and interventions. We need to destigmatize addiction and create a culture of compassion and support for those who are struggling. Addiction is a disease, not a moral failing, and those affected deserve our empathy and assistance. We need to educate ourselves and our communities about the dangers of fentanyl and the importance of harm reduction strategies. This includes providing access to naloxone, a life-saving medication that can reverse overdoses, and promoting safe practices. The fight against fentanyl is a fight for the future of our nation. It is about protecting the health and well-being of our citizens and ensuring that future generations can thrive in a safe environment. It is a fight for the lives of our children, our families, and our communities. We must work together to create a society where everyone has the opportunity to live a healthy and fulfilling life. Together, we can turn the tide on this epidemic and build a healthier and safer future for all. By joining forces, sharing resources, and supporting one another, we can make a real difference. The hope for the future lies in our collective action and unwavering commitment to this cause.